We know that the prognosis for multiple myeloma has improved substantially over the past 10 years. I think something very striking here is looking at reporting the progression-free and overall survival. It's multiple years, not just months, as we see with a lot of disease types. And so we think about this trial starting, you said, I think 2009, 2010, takes this long to get results. We need to invest in this, but standard of care does change. So I think this trial gives very important information related to the benefit and the toxicity so we can have informed discussions with patients. I do think duration of response matters to a lot of patients. Some would much rather go a long time. Others would prefer to put off a very toxic treatment like an autologous stem cell transplant until they might need it later. So it offers information that informs a discussion with the patient, and it helps patients make informed choices. So overall survival is not different. I think 28%, I think, of the patients that had the delayed transplant or the stem cell collection without transplant have gone on to get a transplant. The remainder have not. I also think locking in the benefit of the maintenance lenalidomide is an important concept here as well. So major improvements in a disease that has a very long survival, but these patients are alive generally with disease, not cured of their disease. And we want to give them the best quality of life for as long as possible.